All right, Washington may be the only place on earth where you can underestimate the cost of something by $115 billion. Now, that's exactly what the director of the Congressional Budget Office says happened with the Democrats' health care bill. Now, the surge in cost is partially due to all the new government bureaucracies that this law creates. Yet somehow, despite adding $115 billion of your dollars, the president's OMB director actually told one news organization it, quote, doesn't include more spending. I'm not sure how he's even able to keep his job with comments like that. But I saw all of this coming. I predicted this would happen right here on this show. Well, and now it's time to say I told you so to all of those people who misled you, the American people, about this bill. Remember this.
Add it all up, and the plan I'm proposing will cost around $900 billion.
It reduces the deficit, meets President Obama's call to keep the cost under $900 billion over 10 years.
CBO has scored our bill at less than the $900 billion threshold that President Obama has called for. We've done everything imaginable to get the most generous, most affordable coverage that we could within President Obama's target of $900 billion.
This bill, somewhere will be about $900 billion, fully paid for, done within the healthcare system, and it brings down the deficit.
And joining me now in studio with more on this from the Fox Business Network, Jerry Willis and Dagan McDowell is here. And welcome to both of you. Thanks for being with us.
Thank you.
All right. How do you get off? This is so outrageous. How are you off $115 billion?
Because they needed to sell it to the American people, and you still have the American people, a majority, with 56%, according to Rasmussen, want to repeal this health care because they see what this is. This is a blank check for a giant bureaucracy that has taken us down the road to single payer.
Yeah, and the thing that bothers me the most here, we saw this coming. When they first scored Medicare, it ended up being 9 times what the original cost projections were. The CBO gets it wrong all the time. And by the way, this is only the beginning in my mind. So did they wait just a certain period of time? The American people, they're off health care now, and now we'll just release this information to people?
Well, you know, a lot of this stuff, they say, hey, you know, we knew we were going to have administrative costs. We didn't know what they were going to be. And guess what? We'll find some place to cut to make up for it. But, you know, Congress is not very good for it.
All right. One of the things we did discover is that Kathleen Sebelius, Health and Human Services, that we found out that a week before this bill was voted on, that she was given a report that said exactly this type of thing was going to happen. And they purposely withheld that information from the American people. Now, I think there ought to be some type of investigation. It seems, what if Enron did that? What if Halliburton did that?
Well, that's the way that the federal government is run, and it's only going to get worse. This money, this $115 billion, this is just to set it up. This doesn't even cover any of the health care programs. And if you look out in the 10 years of full spending, this is a more than $2.5 trillion bill.
You know, I got to give the Democrats some political credit. I know that's going to shock some of you out there. In as much as they're really good at this. They're great at demonizing corporations. They're great at demonizing capitalism. They're very successful. And while they're doing that, they divert the American people's attention from government malfeasance, government mismanagement. If any corporation, through general accounting practices, is off by $115 billion, they'll probably be hauled before Congress, right?
Yeah, well, you know, the CBO does this all the time. You said it yourself at the beginning. We see it all the time. Look, this is $39 billion for Indian programs, $45 million for breast education for women, for disease. I mean, you look at this and you start realizing that all these costs are completely out of control.
Yeah,
it was always a fantasy.
I thought Eric Cantor had a pretty good idea when he says you cut. Let the American people decide online the things that they want to cut. Do you like that idea?
Absolutely. Let them at it.
Yeah.
However, what's really disturbing is you look overseas, you look at Europe and the debt crisis over there. We are digging the hole today, right here, right now. And we can borrow very easily now, borrow very cheaply, because people like treasuries compared to what's going on overseas. And all that does is just push this off down the road.
Are you saying what we see in Greece and the violence and the upheaval is coming to America?
Absolutely.
You agree?
$13 trillion in debt right now. We're about to lose that AAA rating.
And we're about to double it in 10 years.
When are we going to lose that rating, do you think?
Could happen as early as 2013, according to Moody's. And that's not somebody who's out there. They're pretty middle of the road.
Well, there's one other issue here is that we contribute 17% of the assets to the IMF, the International Monetary Fund. That means our tax dollars at a time of record deficits and debt, we're bailing out Europe.
Yeah, we're helping.
The American taxpayer is paying the bill for Europe.
Yes.
And they're
helping.
Wait a minute. We're incurring debt to pay for their debt. I want to make sure I got that right.
Yes.
Correct.
Absolutely. Because
I don't know whether to laugh or cry.
And we're even sending dollars overseas and taking euros back in exchange. So we're taking on some of this debt. We're taking on some of these euros that, heck, it's not worth that much.
All right. We're robbing our kids and grandkids of the future. It's frightening.